It's been a while since I've given one of these talks, but I'm Christy Boyd. I am a pediatric sports medicine non-operative faculty member here at Stanford. I've been here for, gosh, I think 7 years, but I've been doing this for about 20.
There we go.
There we go.
All right, can we see all that now? We good?
We are good.
All right, so
Okay.
sports injuries obviously cause musculoskeletal pain. There's two main types of injuries. One is acute, one is chronic. And the reason I go over this is because the different modalities used at home are beneficial for different things. I would say in our office, it's probably 50-50. Ankle sprains, acute injuries, fractures, a lot of non-operative fractures I see in the office. And then the chronic stuff, the 2 years of knee pain, 1 year of shoulder pain, things of that nature. There's a lot of over-the-counter options to treat sports injuries with a variety of claims. And they range from pain relief to healing faster to making improving your performance, or even in some regards preventing injury. So today I want to go over the kind of the efficacy and the safety of these items, so that you are able to provide some appropriate advice to patients with and know the limitations of our evidence behind a lot of this advice. Again, most of the evidence that we have is anecdotal. It's not evidence-based. The studies are not great. You're going to hear me say that multiple times over the course of the next 45 minutes. But I think we need to dive into what we do know so that we can decide which of these things do we need to spend some more time investigating and which of these things are likely just not valuable. All right. I picked ones that are common in our clinic. It just the list just kept expanding and expanding. So at some point in time, I just had to make it to stop. So I'm not covering everything. I'm just covering the ones that we tend to get asked about the most. The visit's ending. They say, well, what about this? Or what, I have this at home. Can I use this? That's the kind of stuff we're looking to cover today. So today's agenda, these are the items that made the top 10 or top 8. The massage gun, kinesio tape or KT tape, TENS unit, laser, ice bath, whole body cryotherapy, these chambers, and then we're going to cover some of the creams, ointments, soaps, patches, etc. that people will use at home. So after I cover each section, I'm going to just answer a couple questions in the Q&A as they come up if need be. All right, the things we're not going to cover today are orthobiologics, so PRP, prolotherapy. I won't answer any Q&A on that. That's a whole different talk. Oral supplements, and then also supplements that are used, protein powders, creatine, etc. I'm not going to go into that today. That's a different talk. All right, so let's start number 1, massage guns. So these are handheld mechanical devices. They it's percussive therapy, so it's burst of pressure to the myofascial tissues. I don't know how many of you guys have actually felt them at home, and they range from a really mild pressure to a really intense pressure. There's a lot of different shapes of the applicator tips. A lot of them come where you can switch them out. There are different stroke depths or amplitude. Some, the more expensive ones have multiple options. The less expensive ones just have one option. It is self-controlled. You can you determine how much pressure you put on the device towards the skin. In 2016, Therabody introduced the Theragun. It was the first mass market gun. So a lot of people will talk about a Theragun rather than a massage gun. It's a brand name, and it was the first mass marketed one that was semi-portable and semi-affordable. So the proposed benefits of the massage gun are that it promotes blood flow, it reduces myofascial restriction, it improves range of motion, it alleviates pain, and it can decrease delayed onset muscle soreness. I'll use this term later as well. This is that soreness you get the day or two after a hard workout. And for many athletes, it's important to decrease that. I mean, for me, if I work out hard on a Sunday and I'm sore for 2 days, it's not a big deal because I'm just going to work on Monday or Tuesday. But for an athlete who's training or has multiple games on a weekend, being sore 2 days later is definitely not ideal. They want to get back into their training. And so decreasing that can be beneficial. So the evidence. So again, these are at the very end of my talk. I have 2 full slides of size 10 font listing of all of the articles I dug through. There's a lot of them. Some of them are good quality, some are not. But I'm going to tackle the ones that I thought were most useful in this talk. So this Ferrara recently looked at 281 different studies, and only 11 could be included. And what the conclusion was is that there may be some help in short-term improvement of range of motion, flexibility, and recovery. Again, this is short-term. It's not recommended for improving strength, balance, agility, and explosive activity. So for example, if you're heading into a game using the massage gun, hoping that it's going to make you jump higher, run faster, probably not going to work. Another Theragun specific study, so they just looked at just the Theragun device, that it was able to improve hamstring flexibility, 2 60-second sessions with a 30-second rest in between. For some of our growing kids, this probably has some relevant value. We oftentimes tell them to use a foam roller. So if they have a Theragun at home, it wouldn't be the worst thing in the world. And sometimes it's a little bit more novel than a foam roller. Some earlier studies have also showed that it does decrease some of the delayed onset muscle soreness. So if somebody had a hard event on a Saturday and had to come back and run in a second event on Sunday or play another game, there could be some value to it. There's no agreement on how to develop these. There's all sorts of sizes, settings, amplifiers. So when you're trying to do a study to figure out what works and what doesn't work, it's very, very mixed. Most evidence is anecdotal. So then again, switching over to safety, because ultimately, as when we're giving advice to families, we can't guarantee something's going to work, but we probably should make sure that it's not going to hurt them. There's very few reports of injuries. This is one that I'm showing you because this is not a good way to use the massage gun. There have been some theoretical concerns of strokes, or if you're doing a massage gun up on the neck, that you can hit some of your vital vasculature. Somebody with osteoporosis potentially could cause fractures. So that's not a good idea. Again, not really our patient population. Bleeding. So if you have a hematoma, so if somebody has a quad contusion or they have a muscle tear and they've developed a hematoma in that area, using a massage gun on there is a really bad idea. That's just going to increase the bleeding. If you're looking at something that's subacute, that's 2 weeks old, that's some scar tissue, that's very different. But staying away from anything acute or any bleeding. And then if somebody has a history of an inflammatory condition, like a fibromyalgia type picture, the microtrauma to the muscle might not be the best idea and potentially could cause a flare. There have been reported cases of really mild rhabdo from somebody going over the top and over the board. And that's also, I think, one thing I'm going to bring up right now, and that I will, you'll hear me say it again later on. There's always that case of somebody who takes this device to an extreme and uses it beyond what's recommended, and it can cause damage. So that would be a rhabdo. So my thoughts, I think there is a potential for range of motion and flexibility. It is a portable method for self-massage. It does do a better job of targeting individual muscles as opposed to a foam roller. They can be expensive. If you use them improperly, you can cause risk, but there are, again, lack of any real good studies to back up their claims. And then the basic rule of thumb, no one muscle group for more than 2 minutes, ideally 20 to 30 seconds per group. Avoid the neck, spine, right on the bones and joints, and avoid acute injuries and contusions. So hold on one sec. All right, so my Q&A, is it going to be recorded? Yes, it is being recorded. And max duration recommended. Yeah, if somebody, what's the max duration? Again, that's just that I probably wouldn't go more than 2 minutes in one. Having somebody else use the massage gun on you, I think that's a little bit challenging, because it really, that's the potential of somebody. No, I would say that's not recommended unless it's like your posterior aspect, but just being really careful on that front. All right, let's go on to the next slide. Now I've lost there we go. KT tape. Okay, next topic. Taping has been used for years and years. In the 70s, kinesio tape was invented by this guy, Dr. Kenzo Case. The initial goal of his research was to improve the body and joint position with tape that was flexible enough to preserve range of motion, but lightweight enough to stay on the skin without causing a rash. He was attempting to mimic the elasticity of human skin. Kinesio is the study of movement, and so that's where that term came from. And KT tape was his original brand, so that's the term you'll hear a lot. But again, it's a brand name. It was donated to 58 countries for the 2008 Olympics, and then in the 2012 Olympics, it exploded in popularity as it became colorful. And so now you see it all over the place. Lots of brands: KT tape, rock tape, spider tape, and it's gotten all the way down into, Rite Aid sells a brand. So again, there's a lot of different variations that have evolved over the past 10 years. All right. So proposed benefits. One is that it potentially could correct dysfunctional biomechanics. It could potentially enhance your performance. It could relieve pain. The evidence on biomechanics, there's conflicting studies. The majority say no effect, that it doesn't really affect your biomechanics. There's no evidence that it helps with performance enhancement. Pain relief. There was a really nice, well, not a detailed study in 2019 where they used basically an MR type study looking at what the KT tape did to the muscle stiffness, and it does have an effect on the superficial depth of the muscles. Again, this was one that I thought was interesting more recently. It was a decent study looking at plica, and again, we see a lot of medial patellofemoral pain in young athletes, and it showed that KT tape plus PT was more beneficial than KT tape alone. Than PT alone. And so there's a potential additive effect that may be beneficial. And then lastly, another nice review shows some immediate short-term positive effect on reducing pain for low back pain, but no improvement in function or range of motion. Again, this is short-term. All right, so again, KT tape is all over the place, used in all sorts of applications. And then of course, with that comes lawsuits. So in 2015, KT tape had to pay a large sum to resolve allegations of false advertisement, saying that it could prevent injuries and provide pain relief. Rock tape had a similar class action suit in 2019. These lawsuits aren't really about that it's not safe. It's more that the claims that they're making have not been proven. Safety of it, skin rashes is probably the biggest thing. Thoughts, it's fairly cheap. I always kind of get a good kick out of these kids coming in with tape all over the place. So I think there's a zillion YouTube videos on how to apply different types of tape. I think it's very safe. I don't think it's going to hurt anything. There's a very strong placebo effect. I think tape does have a sensation tweaking effect. But there's some benefits in some recent research. I think it does deserve some continued study. Again, that's just my opinion. I'm not doing the study, but I do think there is some potential value to it. And so if somebody finds it helpful, I encourage them to continue with it. If somebody asks, is it helping? If it doesn't help, do I need to keep doing it? Then no, I would not have them keep doing it. All right, let me just take a peek. Hey, Sam, I know you're still on. I don't know how to get rid of these questions in my Q&A. So I'm probably messing that up.
I'll take care of it. I'll dismiss the ones that you've answered already.
Awesome. The question is, did I see anything on lymphatic drainage? I did see stuff. I did not dive into it very much because I was really looking at more of the MSK. As far as swelling after acute injuries and that sort of stuff, I did not see much. But as far as in, somebody with a chronic lymphatic issue, there were studies that I did not get into. All right, next. TENS units. So this is probably one of the things I don't have as much experience with because we don't see it very often. When this comes up, it's usually somebody has a unit at home that a parent was using for some pain issue, and they ask me, is it safe or will it help? And so that's kind of the approach I'm taking when I'm talking about TENS units here today. Again, this is nerve stimulation. They're usually available in small portable units. They attach to the skin by adhesive pads. They're a lot of times they're mobile devices that can be worn during activity and with motion. There's small electrical impulses. You can control things like the intensity, frequency, and duration. There's a high frequency version and a low frequency version. It's used a lot in pain clinics for chronic pain, more on the adult side. The proposed mechanism is that the electrical impulses flood the nervous system and they decrease the nervous system's ability to transmit pain signals. There's also some thought that they stimulate endorphins, which help with pain control. It is a non-invasive way. It's a pain relief modality. It's not looking to heal anything faster. So there's really a lack of strong clinical evidence. There's a lot of studies that show positive impact with pain control and chronic pain syndromes, not really with sports injuries. When there is benefit, it's usually short term. Usually the studies that showed the most benefit is when the unit was being worn while the person was being active and moving around, as opposed to like when they're sleeping or sitting still after school. There is a development of tolerance to a TENS unit, so if you use it a lot, it stops working as well. And I just wanted to mention this because a lot of our patients are in physical therapy, and for those of us, I know I have some physical therapists on this call, you're going to think this is really silly that we would even think it's the same thing. But for those of us who are not really familiar with a lot of the electronic stuff, it's different than the EMS or electric muscle stimulation that you see PT clinics use. Those are where they put the ice and stim. You'll even see it in some of the training rooms at the high schools where the kids will come in and they say they use the ice and stim. That is a muscle stimulation looking to cause contraction and relaxation of muscles. It's not used for pain management, but it's in the PT setting to help with either a muscle healing or strengthening of a muscle. So again, TENS devices are pain management devices. Safety, I think they're relatively safe. I mean, the risks are minimal as long as you're following the manufacturer's instructions. The electric impulses can be uncomfortable, and you can get skin allergies to adhesive pads. There was a reported concern that if you put the electrodes in the neck, it can lower your blood pressure. Again, I think that is not a very high risk issue. They are contraindicated if you're pregnant, you have epilepsy, or you have a pacemaker. My thoughts, I think they're safe to use if somebody wants to try one at home, as long as they're not putting it in an odd location or for the wrong indication. I don't think there's any problem for some short-term pain relief on that front. All right, let me just, before I go into laser. All right. Okay, next topic, laser. And again, as I was taking these topics on, each one was like a brand new learning experience for me. And I probably bit off more than I can chew. This is a lot of information we're going to go through over the next half an hour now. But I just thought it would be good to lay it out here. All of this information is going to be available to you after the fact. And so if I'm going too fast over certain things, just bear with me that you can always go back and look at it if there was a topic that interested you. So laser, all right, laser. All right, low level laser therapy. So this is also referred to as cold laser, red light therapy, photobiomodulation. The term applies to low power lasers or LED lights that are applied to the surface of the body. It's been used for years to treat sports injuries in a lot of offices in the professional setting. But now it's readily available for home use for people to purchase themselves. And that's the reason I bring it up here. The mechanism is that, high-powered lasers are used to cut tissue. Low-power lasers stimulate and enhance cell function to help with healing. This is a basic science lesson here. And basically, the end result of laser is to increase ATP, so that enhances the cell's ability to heal, to modulate some of the reactive oxygen species, and then to release and to improve vasodilation. So that's the theory behind it all. Details. Okay, this is way beyond my knowledge base, so I'm going to go basic here. So the wavelength of the laser, and there's a reason I'm going to go into this, but the wavelength determines how deep the light penetrates. There are very strict criteria. This wavelength can penetrate skin. This is the best for most therapies. This is used for superficial. So it is a little complicated. If you go too big of a wavelength, you lose all effectiveness. So there is a sweet spot in here. Power controls the dosage, does not control how deep the wavelength goes. So too low of a dose, nothing happens. Too high, you might get a lot of pain relief, but it doesn't do much healing. Higher power does not make the energy any deeper. That's the wavelength. It's just only faster. So many smaller doses oftentimes produce the same results as a few big doses. So I go over this just to show that it is complicated, and that's why considering using this at home is a little bit troublesome at times. So in 2005, this group, the World Association for Laser Therapy, started produced some evidence-based dosage recommendations, because again, it's the wild world of laser out there. A nice review in 17 showed that it is an effective treatment modality to reduce pain with musculoskeletal disorders. However, adherence to these recommendations seem to enhance the treatment effectiveness. So doing more was not really helpful, and that these recommendations were pretty spot on as to what was working. There was a nice review in more recently that showed there is some bone healing effect that I think has the potential, as we continue to research more about how these lasers work, that may help with some of the bone healing. Let's see, the dosing is complex. It depends on the type of tissue you're trying to affect and how deep you need to penetrate. And there's really a lack of standardized guidelines. The dosing parameters are all over the place. The control trials, do not produce data that's really good for comparison. So everything was pretty inconclusive when I really dug into, what works. I think there's promise just from what I've read, but I think we need to really standardize things a little bit more. So it's been used in the FDA approved cold lasers can be sold for 3 indications: pain control, inflammation reduction, and increased blood flow. Those are the FDA approved reasons. There are different classes of lasers. They are classified based on their risk for damage to the eyes. In California, lasers can be sold for home use with the recommendation of a healthcare provider. A lot of times the manufacturers have a doctor on staff who writes a letter so they stay in compliance. The vet and pet market is the fastest growing segment for this industry. The FDA does not regulate lasers on animals. So therefore you can imagine that patients can buy vet lasers and use them on themselves. So you can buy any FDA cleared devices or any other low cost non-FDA devices. So again, when somebody tells you they're using a laser, it's really important to figure out what exactly that they're using before you can say, yeah, that's a great idea, or hey, I don't know if that's a really great idea. There's some really powerful new lasers out there with a lot of claims. But again, it's really about sticking to the ones that have been FDA approved. All right, LED. This is a new thing that you're seeing all over Amazon. They deliver a portion of the true energy into the tissue compared to the lasers. It's usually used very superficially. They might have the correct wavelength, but they don't have the energy to get it into the tissues. It's about 5, so this is really probably not having a very big effect. Some devices out there are a combination of LED and laser, which again has not been studied as a combination, but has the potential to be effective. So safety, they're well tolerated, very few side effects. Oh, I cut off part of the sign here. You probably should wear eye protection if you're using it near your eyes. They're contraindicated if you have an embedded electronic. It's photosensitive or like patients. If you visually look at them, they could potentially trigger a seizure. Developing bones, and this is what's relevant to us in the pediatric world. There were studies on rats, that showed if you used this higher wavelength daily for 21 days, that it did have a negative effect on the physis. So there is a theoretical effect if you used a ton of laser along the growing bone, it could affect the development of the physis. So there may be some clinical benefit. It is an alternative to the analgesics. It's safe, I think, for most injuries, as long as you're using a reputable device. I would just recommend that we stay away from on a daily use of the physis and the apophysis. So I would not use it on, a chronic iliac crest apophysitis on a daily basis. So I think that's a good idea. All right, let me just. Simple question. Do I believe these devices actually work? I think there potentially could be some benefit for these devices. I don't think the LED wraps that you get, I don't think there's any evidence on that front. But I do think that especially for some of the fracture healing things, wound healing, deep tissue injuries, I think there is potential. I think we've got to really better refine what wavelengths, what powers, the treatment protocols, etc. All right, as you can see, I'm switching to ice. And I can tell you right now, I'm going to be a little short on time, so I might skip through a couple of slides, just in the interest of making sure I get to the end. All right, so ice. Cryotherapy is any modality which cools the body for therapeutic purposes. So it's an ice pack, cold water immersion, whole body cryotherapy. So the history of rice. So historically, it's the first line of treatment for medical injuries. The ancient Egyptians used cold to improve health and reduce inflammation. The Greeks and Romans were there too. In 1978, Gabe Merkin, in his sports medicine book, coined the term rice. The second component is the ice, which is what we're going to talk about now. It was intended to quickly and effectively minimize pain, restore mobility, and return athletes to the field. That was what the rice was designed for. Fast forward 2014, Dr. Merkin updated his findings and concluded that rice actually may delay the body's natural healing process. So if you continue to use rice for 2, 3, 4 days, that maybe that's not the best idea. He cited several studies showing that there's little evidence that ice promotes recovery. Again, this is recovery, not pain control. And that cooling of damaged tissues and complete rest inhibits blood flow and inflammation from the area, and hypothesized that if you inhibit inflammation, you're going to slow down healing and prolong recovery. Like, the inflammation is good because that's your body's natural way to heal. So the inflammation is a natural and healthy response, but prolonged inflammation can do more harm than good. So from there came this, which I'm not going to go into detail, but a zillion other substitutes for rice, many of them avoiding ice. All right, I'm going to actually fly through this one. This is more about how injuries heal. There's really 3 phases. Phase 1 is inflammation, phase 2 is remodel, and phase 3 is regeneration. And what is the role of ice? I think ice works as a pain reliever. So it reduces the sensory transmission in the inflammatory phase. It can decrease, it causes vasoconstriction and decreases the metabolic rate of injured tissue. So it can prevent secondary ischemic injury and inflammation. So whether or not the benefit of avoiding secondary ischemic injury outweighs the benefit of decreasing inflammation or of limiting inflammation is still yet to be seen. So have we gotten away from ice? And that's the question. I get that all the time. Should we ice it or should we heat it? I've heard ice is bad. Someone told me no, never to put ice on an injury. There's no clear consensus about the use of ice. Ice in 15 to 20 minutes does improve pain because it reduces edema and inflammation. Reducing pain theoretically could help decrease the overall recovery speed, but there's no evidence proof. So I am still a proponent of ice in the first 24 to 48 hours after injury, for this reason alone, just to decrease the edema. Because once you get a lot of edema in an injury, a lot of times it's very hard to then get it to go away, and that delays your recovery. There's more evidence about the benefit for ice for recovery and delayed onset muscle soreness. That's probably where most of the research has been done. I'm going to get into that in a second. And again, most of the recommendations about ice are based on anecdotal evidence and theory, not scientific studies. I just said that. All right, so ice baths. Active ingredients, simple ice and water. Typically, it is used to reduce post-exercise muscle stiffness and soreness, to eliminate fatigue, and to decrease that DOMS, the exercise induce muscle damage, and improve recovery. The body temperature and the reduced body temperature reduces blood flow. It decreases your inflammatory response. The endorphin rush can help reduce fatigue, and the decrease in surface temperature potentially could minimize hypoxic cell death. The evidence, cold water immersion can help your performance for up to 24 hours, but not beyond. So for example, if you had a football game on a Friday night and you needed to be able to play in a soccer game on a Saturday, kids do that, getting in an ice bath on Friday night would help you on Saturday. If you had a football game on Friday night and we're going to rest all weekend and not go back to practice till Monday, there's probably no benefit whether you jump in an ice bath other than you might feel better. But by Monday, your recovery will be the same. And then another similar study showed the same thing. It's most effective for the first 24 hours, but if you actually look at people several days later, their recovery is the same. Lots of studies had bias. Again, lots of stuff about using it for delayed onset muscle soreness. It's no more effective than other forms of active recovery. So again, if you don't have access to an ice bath and you go home and you do some stretching and you do some gentle range of motion, that probably is just as effective as an ice bath. It's very commercially available. So the main dangers we worry about are drowning, hypothermia, and cardiac arrest. Contraindicated for these individuals. Somebody who has a propensity to have cold urticaria or Raynaud's, I'd be careful with. Somebody with an underlying heart arrhythmia. My thoughts, I think the evidence supporting cold water immersion is probably the strongest of any of them, especially in somebody who has a multiple game weekend or needs to feel better within a day or two. I think there's value. Usually I recommend 10 minutes is the best duration. And again, it's useful if it's consecutive days. All right, real quick. Can you share my PowerPoint? How cold does it need to be to help? That's the 50 to 60 degrees. And we'll talk about that again. I'm going to get there with the next slide too. So whole body cryotherapy, again, this is a hot topic that I don't know if I have great answers on. So basically it's these facilities that you go into and they expose your body to really, really cold temperatures for 2 to 4 minutes. The proposed mechanism is all of the proposed musculoskeletal benefits. So again, there's a lot of other proposed benefits I'm not going to talk about. But the thought is that it lowers the inflammatory substances within the blood and body, decreasing swelling and inflammation. It slows nerve conduction to help with pain. And then when you get out and you warm, it increases blood flow and can help with healing. So when they advertise it to athletes, it's pain relief, you're going to heal faster, speed your recovery, and have less delayed onset soreness. It is a celebrity. We call it celebrity cryotherapy. You can see LeBron and Will Smith here advertising for a lot of these companies. The evidence is that it can lower your skin and muscle temperature to a similar degree as icing. It can reduce the soreness in the short term and accelerate the perception of recovery, but it did not lead to improved function or performance after the fact. And this was an interesting one that was in 2 different studies. It doesn't alter the amount of muscle damage as reflected by blood tests. They did some work looking at muscle breakdown, and it did not change those. People continue to report subjective improvement in pain, soreness, and recovery compared to other recovery strategies. So subjectively, patients like it. They report it makes them feel better, but we don't have the scientific evidence to prove it. Why? Well, the ultra cold temperatures do have quite an endocrine response and release adrenaline, noradrenaline, and endorphins. And in fact, some of the better studies on these tanks are related to using it for anxiety, depression, fibromyalgia, things of that nature. All right, potential risks are frostbite, cold urticaria, bradycardia, nerve injury. Risks can be minimized by safety protocols. It's similar contraindications to an ice bath. My thoughts, it's readily available. It is pretty expensive, and I'm not sure it gives any other benefit other than an ice bath. And so I probably go that route. But if somebody wants to do it, I tell them it's fine if they want to pay for it. We need some better designed studies on it. All right, I'm gonna jump into creams and ointments. So topical treatments. It's a very practical alternative to oral drug delivery. It avoids first pass metabolism, lower systemic events, direct application over target areas. Topically delivered agents, they can accumulate in therapeutic concentrations. So I'm going to skip all that. The permeation of the drug across the skin is probably the biggest challenge. And the delivery vehicle, whether it's an ointment, a gel, a cream, a lotion, a spray, or a patch, really affects how it's absorbed. So the active ingredients, there's a ton of them. The estimated value of the topical pain relief market in the US is at 11 million, and it's expected to only increase. Many of them are marketed towards sports injuries and pain relief. There's not a lot of reliable data. Many of them function as what we call a counter irritant, which causes irritation and inflammation of the skin, and it relieves pain by overloading the sensory receptors in the nerve endings. So we'll hear that in a second. These are the ingredients. I have slides on each of these. Again, I don't have enough time, I don't think, to go through each of the slides, so I am going to skip a few, just so I'm not talking a mile a minute. I'm already talking a mile a minute, but anymore. Arnica, capsaicin, camphor, turmeric, Epsom salts, menthol, methyl salicylate, and NSAIDs. And I'm gonna breeze through those first 8 and really focus on the last 2, because I think there's some important information to tell you on those ones. Most of our data is on topical NSAIDs, which actually I think is somewhat encouraging. So Arnica, I'm gonna just skip through that. Thoughts: well tolerated, unclear benefit when used alone. It's commonly used in combination products like this one, Pediatric, which is the sponsor of the National Pickleball Association, and John McEnroe. So again, well tolerated, safe, not great studies showing that it helps. Don't ingest it. And again, in a lot of the topical products, you'll find it in it as a combination. Camphor, again, this is what we typically see in Biofreeze, Bengay, Tiger Balm. It's very unsafe if you eat it. It creates a warm and cold sensation. This is, you don't want to be above 11%, otherwise it becomes toxic. It is effective at relieving pain in short term, and again, that is all as a counter irritant, meaning that its actions on nerve endings cause analgesia. All right, capsaicin, hot pepper, burns, counter irritant. Wear gloves, avoid eyes. It's not my first choice. I don't find that patients ask very often about this one. This is found in capsaicin, Salonpas hot. Again, an Asper cream. This is not one that patients come in frequently. I don't, it's not one of the ones I typically would recommend. Topical. So I'm going to skip this one real quick. This one we're going to go past. Epsom salts. Epsom salt baths people do all the time. It's magnesium sulfate. The thought is that if you soak in a bath of magnesium sulfate, your body will absorb the magnesium, which will help with muscle soreness, swelling, and inflammation. Evidence is that the magnesium does not get absorbed through the skin, but a bath is relaxing. So yes, it's safe. Check the water temperature. Don't do it if you have open wounds. It's relaxing. Soaking blisters in Epsom salt actually can be helpful because it affects the endothelial layer of the skin, and that's actually one of the areas that I find does have some benefit. All right, menthol, zoom. Again, it's also in Biofreeze, and it's frequently used in combination with camphor. It's a counter irritant. Again, it's in Biofreeze and Icy Hot. This is the one I wanted to talk about, methyl salicylate. This is a wintergreen. It works by several different factors. It does have a topical analgesic. There is some inflammatory benefit. It's a counter irritant. And then it also it's a vasodilator. So it makes things, desensitizes, and then it makes things warm. You probably can imagine what products this is in. Bengay, BioFreeze Professional, so the stronger BioFreeze, and Icy Hot. The reason I wanted to spend 1 minute on this slide is everybody uses it. It's super common. The safety data is limited. An 8-hour application of a patch did provide good pain control. So I think there is, compared to a patch that was just a placebo. So I do think there's some benefit to it. There are case reports of toxicity. There was a 17-year-old cross-country runner from Staten Island who passed away, and they found toxic levels of methyl salicylate in her body and felt that it was from inappropriate use of Bengay and Icy Hot that had been absorbed into her system. So I think this is a very unusual case, and it must have been a lot being used. But I think on the whole, Bengay, BioFreeze, Icy Hot, they're all good for pain relief. And I think they're safe. Methyl salicylate, just so you, as a fun fact, is the ingredient that is in the Lifesaver wintergreens that give them that that color when you crack them in the dark. All right, lastly, topical NSAIDs. There's a zillion of them, 10 dosage forms, more than 10 ingredients. Topical application is 2 to 6 times out of oral administration. There are a lot of really good studies that you're more than 4 times likely to reduce acute pain by 50% or more compared to placebo. It's more effective. The most effective were diclofenac gel, which is Voltaren gel on the commercial side. And there is better compliance with topical as compared to oral. So there are local skin reactions, but the systemic adverse events are low. It's contraindicated for mucous membranes in your eyes. Patients who are allergic to oral ibuprofen or NSAIDs are discouraged from using it just because the theoretical absorption into the system could potentially trigger an allergic reaction. Topical NSAIDs, especially diclofenac, have been used way more commonly in Europe and Asia than in the US. The penetration varies from person to person and product to product. So it really is hard sometimes to figure out how effective the different options are. And there's not a lot of data on pediatric patients, less than 12. So Voltaren gel is the one that we probably hear most about. This says very similar to what I just said. What's interesting is that in 2020 in the US, the 1% strength became available over the counter. So it was Voltaren gel initially. Now there's a lot of other generic brands. Costco has their version, etc. There's very strict, there's very detailed instructions on how to apply them. In other countries, there is a patch and a plaster and a 2% gel. So patients can, if they're traveling, get this in other countries. This is over the counter in other countries. And there's a good study out of China using the 2% twice a day for an ankle sprain, and there was a clinically significant improvement in healing or in recovery. So I do think there is potential moving forward for more studies on the stronger versions of the products. Most of the products your patients come in with are combos. So they're not going to just be one or the other. They're not going to come in and say, I'm taking this or that. So like Icy Hot is methyl salicylate and menthol. Tiger Balm is a little bit of everything with some capsaicin. Bengay has multiple versions, one with methyl salicylate, one without. And so it's really important to look at the ingredients of what they're putting on themselves. If they just say Bengay, it could be anything. The final thoughts, I like the topical application of things because it avoids the GI system. There's not a lot of systemic side effects. You can stop it if there's any side effects. It's direct access, and there's better compliance than taking a pill. The cons, it has to diffuse across. There's a lot of variability on skin permeability, and local skin irritation can be common, and people can go overboard. Like this stuff is not encouraged. Putting Bengay and then wrapping it on plastic wrap around, things like that. People do go overboard, and this is a challenge and obviously contraindicated. All right, and then again, just as I'm going to use this as my last slide. So for pain control in the acute setting, things that are potentially useful: ice, topical creams, gels, and patches, laser, and KT tape. For chronic pain control, again, the topical stuff, a TENS unit, laser, KT tape, and for recovery, ice bath, massage guns, and laser. Again, evidence on all of this is anecdotal. Most of it is anecdotal. I think laser and diclofenac gel probably have the most promise of everything I've looked at, that I reviewed, short of the Theragun having some potential benefit with range of motion in some of our really tight growing teens. I'm going to stop there. My email is down here at the bottom. Please feel free to reach out if you have any questions. I can't guarantee I have answers, but I'll give you my best. I'm going to look in the Q&A now. Yes, that one's done. Any studies on patients who typically are advised against ibuprofen use? Yes, so there's no studies on them, but theoretically there is concern, and so they are contraindicated. Topical lidocaine, that was one of the ones I did not tackle that one. Yes, the topical lidocaine has more potential for skin reactions than some of the other topical patches. It can provide short-term relief. Please. Oh, okay. Hold on a sec. I got to fix my slide. So as I promised, there's a zillion things here that I went through. This slide right here, I think, is what you wanted. There. Okay. Well, let's see. I'm tackling questions. For elderly patients, you know, so I went in, I went into pediatrics because most of these kids don't have other, pre-existing conditions. There were a lot of concerns about individuals who have cardiac history, who have underlying other medical conditions. And so most of what I've talked about today does not apply to elderly individuals. Oops, I didn't. All right, well, hold on a second. This isn't the slide you want. There we go. Okay. Okay, elderly patients, I'm sorry, I'm trying to click on my questions. Here we go. What is the lightest weight massage gun that is most effective? Any of the smaller travel ones recommended. Again, it has less to do with how much the massage gun weighs and more about the percussion that the gun provides. And again, there are no studies showing what is the optimal kinetics behind it. You also can affect it by how hard you press the massage gun against your skin. Contrast baths, hot, cold, like hot tub, ice, hot tub alternating. I typically, again, that was one thing I skipped because as you can see, there's too much content in this talk. It can help with swelling reduction. So if you have a big swollen ankle, that can help the vasodilation and the contraction. But I don't use it typically in the acute injury setting. I use it more if there is pre-existing swelling in somebody. Will you have access to these slides? I hope so. I know this is recorded live, so if nothing else, you can just go through and pause and get the information. I know it's a lot of information, and it just kept growing the more I was going. So, I was a little hesitant to take on a new challenge. So I hope this goes okay for you guys, and it's not too much, and I didn't talk too fast. But I think the more information we can get out there, the easier it is for us to give good advice. Is Voltaren okay to use on joint pain or back pain? Theoretically, yes. I think that there is, you can use it in that large of an area. I would not do a whole body application, but yes, I think that is an appropriate application for a Voltaren gel. Thought on moist heat. Did not look into it. Typically for muscle spasm, I like moist heat. I find that it does, it has been anecdotally shown to help with muscle spasm, but that was not one of the things I dug into.